tragedy came when my auntie, who had hepatitis C as well, was in need of a liver transplant. She didn't take medication properly, regularly, so her hepatitis C turned into a cirrhosis quite quickly. And one day, a doctor said that the only way to save my auntie's life was through a liver transplant, even though it's going to be quite risky, because they found that the liver compatibility between my younger cousin and my auntie wasn't that good. Several days after the transplant, my auntie passed away because there was a liver rejection. I always think that if my auntie was more health literate and took proper medications earlier, she probably wouldn't come to this stage and took such a risky transplant.
Health literacy has many academic definitions, but everyone can understand its significance in the light of the old slogan. If you think education is expensive, compare it to the cost of ignorance.
就是从小培养就是这样，就是爸爸妈妈如果我感冒就是带我去看中医，然后我自己是觉得如果只是咳嗽、流鼻涕就还好，就是睡就是多休息，然后多喝水，就只有发烧的时候才会去那个 clinic。
然后那时候就是有吃，那后来西药但是急救把它救回来了之后，我有吃一段时间的中药，但是效果好像没有很明显，也可能我那时候只吃4个月吧，然后后来我就还是都吃西药，会吃补品，但是不会特别吃中药。
People around the world have different cultural approaches to health, and some people will inevitably lack health literacy. Consequently, these differences may cause people to seek treatment late and fail to take responsibility for their health with preventive screenings and wellness habits.
The patient always have lower literacy other than, the medical professionals. Medical professionals try to communicate and try to educate the patient with the right knowledge. Once the patient is not aware about the prescription or kind of medication, something like that, then they will fail to follow those orders from the medical profession. So that would jeopardize their health outcome in the end.
The results of people with low health literacy levels can bring an enormous cost burden to the healthcare system. As a consequence, the annual costs for individuals with low health literacy skills can be as high as 4 times the amount than those with higher literacy skills. Health literacy research is quickly becoming an important factor in health systems around the world. Professor Sarah Gibney is working with a public-private partnership using health literacy to augment diabetes care in Ireland.
But I'll give you an example from Ireland. The most recent health strategy now mentions health literacy twice in the area of community and personal development. That is a huge step to actually have that term enshrined in a national strategy. But there's another step to take it from mentioning it to actually operationalizing it.
I already mentioned here in Taiwan, national health insurance. We all talk about reform from the provider side, government side. People don't join at all. The problem is solved not by government, by community themselves. Elite of the community mobilize all of the volunteers to help the people, to serve the people, should come from the grassroots level, community themselves.
So I think nowadays we need some very powerful health promotion programs to make them understand what is the right information and what is the right thing you have to obey, how to secure your own health status. I think this is one thing we have to do in the next level.
Everyone has a role to play in fighting health illiteracy. As better informed citizens become more empowered to take responsibility for their health, governments can direct public resources where they are needed most. Let's make a difference together.